Hi, Dr. Frank Johnson from Sport Medicine Ultrasound Canada. For Achilles, you simply slide around the corner like so. Now in this case, everything's the same. Patient position is still prone, foot off the end of the table. Landmark is still going to be calcaneus, but in this case it's going to be the posterior calcaneus. The movements again are going to be slight movements medially and laterally until you see the entire width of the Achilles tendon. The movements also are going to be some slight angulation until you get the tendon nice and bright along with the bone. And the area of interest is going to be between the skin and the calcaneus. That's your Achilles tendon. Now, it's also worthwhile noting that most of the pathology of the Achilles tendon is either going to be directly at the insertion or it's going to be a few centimeters proximal, what we call the mid portion of the Achilles tendon. I'm going to show you how to scan and inject an Achilles tendon. Patient position is prone. The landmark is going to be the posterior calcaneus. The orientation of the probe is long on the lower leg up towards the knee. You can see the yellow arrow is currently inside the Achilles tendon. Now, for PRP, if there were a tendon lesion, I would simply place the PRP inside the tendon where that yellow arrow is. However, for cortisone, I would go deep to the tendon into the Cadaver's fat pad about here. Now, there is some disagreement about doctors about the safety of the Achilles tendon and cortisone. I fully agree, we would never put cortisone into the Achilles tendon. However, many doctors, in certain cases, will put a small amount of cortisone deep to the Achilles tendon in the Cadaver's fat pad just here. The angle of entry would be like this. We would spin the probe 90 degrees, and for cortisone, we would place the needle entry like so and touch the yellow arrow. And for PRP, the needle entry position is the same. However, the target is within the tendon itself. And that's how we scan and inject the Achilles tendon.